Good morning. My name is Michael Bernswag. Today's date is 5/9/2025. Today I'm going to be speaking about some key concepts that we went over in last week's Module 1, Chapters 1 and 9. This is my little handwritten sheet, front and back, and I'm going to start now. So I'm going to start off with the definition of a disease. The definition of a disease is any deviation from the normal structure, normal function of a body in the body. You know, uh, caused by a disease. And an example of this would be type 2 diabetes. Type 2 diabetes is a disease where uh, and the body can't effectively use insulin. So then that leads to hyperglycemia, and that's just an example of an actual disease. Um, Next is the disease classification. Disease classification is how a disease is grouped together and able to be classified. Some examples of this could be where the disease is starting. The nature of the disease. Is it inflammatory? Is it neoplasia? Is it acquired? Is it congenital? Is it acute? Is it chronic? Um, and a specific example of, let's say, an uh, acute disease could be acute cholecystitis or acute appendicitis. So, that's where it is. It's in appendicitis. It's in the appendix, and it's inflammatory or infectious in nature. Versus another classification of a disease could be chronic hypertension. Those are two different classifications, two different diseases. Next is the etiology of a disease, and that's the cause of the disease. The cause could be biologic in nature, which is like it could be bacteria. It could be chemical in nature, which is like toxins, like alcohol. It could be physical in nature, something like trauma. A specific example would be, in tuberculosis, the initial cause of tuberculosis is the bacteria Mycobacterium tuberculosis. So, that is the etiology, the cause that can cause tuberculosis is that actual bacteria. Next is pathogenesis. Pathogenesis is how a disease develops, from point A to point B, from the cause all the way up into the manifestation of the disease. An example of this is something that we went over in the first week's module, which is stress-related illnesses, the pathogenesis of that. So we have a cause, which is stress. We have a stressor, which then could lead to the overreaction um, of the hypothalamic pituitary adrenal axis, which then could lead to peptic ulcers. It could the HPA could lead to increase secretion of stomach acid, which then in turn could um, end up causing peptic ulcer disease. So that's kind of like the pathogenesis of that. Um, and the next is signs and symptoms. Let's say, and an example of that, could be stress again. A symptom, that's something that's subjective. You can't see it, you can't measure it. It's subjective. The patient is telling you what's going on. So they could come in saying they have anxiety. You can't see anxiety. The patient is telling you they have anxiety, but it's subjective. And then you have signs. Signs are objective. Signs you can measure. A sign of stress and anxiety could be increased heart rate, increased blood pressure. So you can measure that, and those would be the signs. And then you have syndromes. Syndromes are basically like a cluster of signs and symptoms that then create a syndrome. Like PTSD. PTSD is a psychiatric syndrome. And some symptoms of that could be, hyperarousability, avoidance, um, intrusive thoughts, and then put that all together with some sort of traumatic event, such as someone being in active duty or someone being in a car accident, and all those combined together create a syndrome, and that syndrome being PTSD. Next is diagnosis. Diagnosis is the identification of a disease. And to make the identification of disease, the whole, you need a bunch of factors to make that identification. So that could be, risk factors, history, physical examination, diagnostic tests. An example, we can go back to tuberculosis. Someone with HIV or that is immunocompromised, they're at a higher risk for getting tuberculosis. On a physical examination, you take their temperature. Their temperature is elevated. They're having, a specific, color sputum upon, auscultating their lungs. And then diagnostic tests. Diagnostic tests could be, you get a chest x-ray, you see a nodule, you're taking a culture of their sputum, and it comes back that, it is Mycobacterium, tuberculosis. And then now you're able to make that diagnosis of tuberculosis. And then diagnostic tests, which I just touched upon, but a diagnostic test is, what's used to help identify and make a diagnosis. So, in the tuberculosis example, it could be, like I said, lab work. It could be like a quantum fear gold test. It could be an x-ray. It could be a sputum culture, and stuff like that. It could be a diagnostic test. And then there's complications, and a complication of a disease. So that's basically any adverse effects that happen to the body, resulting from a disease. And we can use stress again for this. And the example I gave before about peptic ulcer disease, and a complication of stress, which is a disease, could be peptic ulcer disease. And with the increase of acid secretions in the stomach, it could create peptic ulcers. And lastly would be prognosis. Prognosis is basically the expected outcome of a disease. And we'll use a new example for this, which could be cancer. Someone with stage 4 pancreatic cancer, they're not going to have a good prognosis. They could be given, 3 to 6 months to live, compared to someone who, gets diagnosed with stage 1 breast cancer, who, was practicing early detection. Someone who has stage 1 breast cancer is going to have a way better expected outcome than someone who has stage 4 pancreatic cancer. So that's kind of, the difference in prognosis. That's everything I had to talk about today, and all the concepts and definitions that I kind of had to go over. So thank you, and I hope you enjoyed.